Now, how are these similar? So we have things with sympathetic nervous system and parasympathetic nervous system over here. Well, they both have, remember when we talked about like how many neurons you need to get from one place to another? So starting with the spinal cord, that's where we're starting out. So we do have signals coming up from the autonomic areas of your brain. But say we're starting at the spinal cord. So the first stop is what we call these pre-ganglionic fibers. So these pre-ganglionic fibers, I can't English today, they're leading from the spinal cord to the ganglia. So there's one step right here. So it's one nerve, and then you have the post-ganglionic fibers. So again, ganglia are a group of cell bodies. And then this post-ganglionic fibers, they're going to lead from this ganglia, and they're going to go to these target organs or tissues. So this is what we have, the pre-ganglionic and post-ganglionic. So can excitation or adrenaline cause the urge to urinate and defecate? And that's the interesting thing. So this is why they're not necessarily, even though there's dual innervation and they tend to have opposing effect if they have innervate the same organ or tissue. Thing is that you always have one, even it's not like one, you have an increase in sympathetic activity and that the parasympathetic is totally shut off. They're always there at some level. So sometimes like with the sympathetic nervous system kicking in, and we don't get to really cover the acute stress response too much in detail until next semester. But yeah, with the acute stress response and the general adaptation syndrome, you have that sympathetic activity. But the thing is that over time, your parasympathetic tries to dial back the sympathetic activity. So say you have sympathetic, your parasympathetic is starting to increase in the background, then you lower your sympathetic activity. Now parasympathetic kind of kicks in. So this is an interesting thing. Sometimes the parasympathetic system is trying to slam the brakes on things too much that actually becomes the dominant thing. So yeah, that's why sometimes you have this parasympathetic nervous system kicking in or becoming dominant when it's a stressful response. At least that's one of the leading theories behind why, yeah, excitation, some people like urinate and when they get excited. So sometimes, yeah, it's funny, like the stress kicks in, but sometimes with the sympathetic, but then the parasympathetic sometimes, it's always in the background, but sometimes it overshoots. And that's why we get like things that are typically parasympathetic appearing in typically sympathetic situations. All right, so again, the ganglionic and pre-ganglionic over there. So the ganglia is a group of neuron cell bodies. Again, you need to know what ganglion is if you're going to understand innervation with the parasympathetic and sympathetic nervous system. So the fibers leading to the ganglion, so they're going from the spinal cord to the ganglion, is pre-ganglionic, and the fibers leading from the ganglion to whatever target organ or tissue, that's post-ganglionic, sometimes just called ganglionic. So, but pre-ganglionic is always called pre-ganglionic. Post-ganglionic, sometimes they make the post optional. For clarity's sake, in my class, I refer to as post-ganglionic. So just FYI if you're taking other classes. So for the sympathetic nervous system, we have the pre-ganglionic fibers starting in the spinal cord and leaving there and innervating these leading to these ganglia, and then the post-ganglionic fibers going from the ganglia to whatever target organ or tissue. Now the parasympathetic nervous system, it tends to have longer pre-ganglionic fibers on average compared to the sympathetic nervous system. So the ganglia in the parasympathetic nervous system are located further on average than your sympathetic ganglia. So longer distance of the pre-ganglionic fibers and very relatively short post-ganglionic fibers. So sometimes they're so short, or the ganglia is located right next to the organ, or sometimes within the organs itself. So this is one main difference between the sympathetic and parasympathetic nervous system. So the difference is that yes, similarities is that they both have pre-ganglionic and post-ganglionic fibers. Both the sympathetic and parasympathetic nervous system have ganglia. But notice that the pre-ganglionic fibers are relatively short in the sympathetic nervous system, whereas they are longer in the parasympathetic nervous system. With the post-ganglionic fibers, they're relatively longer in the sympathetic, but relatively short in the parasympathetic. And actually right here you can see that sometimes the ganglia are located right next to or inside these organs in the parasympathetic nervous system.